Hello everyone, my name is Dr. Simon Towler and I've recently been appointed as the End of Life Care Clinical Lead with the WA Cancer and Palliative Care Network. Some of you will also know that I'm a staff specialist in intensive care at Fiona Stanley. And the challenge we all face at the moment is very much confronting the two roles that I'm principally involved in. At the very outset, what I wanted to do was to acknowledge the traditional landowners of the land of Western Australia, and particularly those in Perth here, the Whadjuk people of the Noongar Nation. And for them, as much as the rest of us, this new pandemic, COVID-19, will challenge everybody, will challenge them as individuals, it'll challenge our health system, it'll challenge all of us as health professionals to deliver quality care. COVID-19 is a new experience for all of us. We all know the history of swine flu. We all know the impact on the world in 1918. But most of us didn't ever really expect that we would see it in our lifetime. What we have now is a viral illness spreading across the planet, which is resulting in many people needing advanced care in hospitals, and it is overwhelming healthcare systems. You only need to see what's happened in Italy. But although we can become very fixated and focused on the issue of access to critical care services, which I clearly understand in detail, what about everybody else? It's really important for all of us that we think about all the vulnerable communities, and particularly those older people who are at greater risk, and what their experience is going to be. In the last week, we ran 2 seminars. We had over 100 people participate. We explored the views of people working in the sector, from the acute care clinicians like Professor Fiona Lake in the very front line at Sir Charles Gairdner Hospital, having some of the earliest experiences encountering this disease. We also engaged our palliative care clinicians, our community partners, the WA Primary Healthcare Alliance, Silver Chain Organisation, and all the healthcare providers, and beginning to look at the stresses and duress this is putting in our system, but with the specific purpose of trying to understand what the priorities are and how we can, in thinking about the care of people who are vulnerable or those already at the end of their life, how we can ensure they get the best possible care. A whole range of issues emerged. There were questions around logistics and supply. How do we get the basics to ensure that the quality of care in whatever clinical setting the person finds themselves, whether it be at home or the residential aged care sector or in hospital environments where it's not traditional, we made available and will be able to make available the kind of drugs, medications, devices that will ensure the quality of care meets the standard we expect. We were really privileged. People from the residential aged care sector who face really challenging circumstances were present in those meetings. They were looking to us for direction, but sharing their lessons with us as well. We all know that some of the earliest tragedies of the COVID-19 experience in Australia was a residential aged care home in Sydney, which has now resulted in a number of people succumbing to the disease. Bold decisions have had to be made. In residential aged care, visiting has been reduced. But very importantly, the residential aged care sector has been leading the way in thinking about having important conversations with people, with their patients, with the families of the people who are in their homes, about what would you want if you became sick. And what a lot of them are saying is, I don't really want to go to hospital. What this is all about is the principle of planning in advance, some form of advanced care planning. A colleague of mine, though, has coined a great expression which you might call now planning. Because differently to our traditional approach, we now need to be making decisions at the moment in the setting you find yourself, because this disease is spreading in our community. We were privileged also to have many senior clinicians. It's very important to recognise that we don't need to make up or design the responses. Great clinical leadership across Australia is putting together good protocols, good approaches and recommendations which we will build upon. What we intend to do is to create an opportunity to share information to our partners in the sector, to make available to health professionals good information to make good decisions, to look at the opportunities to share the lessons and ensure that we communicate widely and specifically to meet different people's needs. An important domain for us is the country. The services available in the country are different, but there's great people working out there. We'll be supporting them, and they'll need to be integrated with community pharmacies through country health services, but also linked into our network of communication back to the hospitals, engaging the Royal Flying Doctor Service, and looking to the opportunities that exist to ensure that the right patients go to the right location for the right care. We do not underestimate the enormous challenges that come with this particular disease. We know that the kind of clinical syndromes that occur means that people will be affected. Some people will be very short of breath. Some people will have increased confusional states. People will be living in homes. Families will need to be supported. And the health professionals will need to provide the best possible advice in the individual clinical setting. We're going to follow up this brief introduction with some special information to assist you in thinking about advanced planning. We will be providing information and supporting health professionals. We're also looking to the aged care sector to understand how they might involve themselves in what we call goals of care. Because the better we are planned in advance, the more we are prepared to support people in different settings, the more the experience of the individual patient will be as good as we can make it. I really thank you for your interest, and we look forward to providing you with additional information as we go forward.